Hi, I'm Robert Kirsner, Chair of Dermatology at the University of Miami, and I had the opportunity to speak at Maui Derm on wound healing, and I highlighted a few different things that I think of interest. First and foremost, we talked about skin substitutes. A lot of scrutiny around skin substitutes because of excessive use, over 40 times increase in skin substitutes over the past several years. Over $10 billion were spent on skin substitutes. So both payers and the government is paying special interest. So use skin substitutes judiciously. Let the evidence and patient selection really drive the use of those products because they're going to be scrutinized to some extent. But because you may not use skin substitutes as often, I also talked about other ways to close wounds, including skin grafting, both older skin grafting techniques like pinch grafting, which is really simple, and recently there was a randomized controlled trial that proved the benefit after Mohs surgery on the legs, but also more novel ways to skin graft, ways to take the cells and grind them up and deliver the cells not as a sheet, but even as a spray or liquid. You can harvest that skin from the thigh or from the hair follicles and then derive the cellular and extracellular components of those grafts and deliver them. Also very hot these days is fat grafting, either harvesting fat and injecting it around wounds, or harvesting fat and then bioprinting it in a size that's specifically made for the wound you're trying to treat. And that's going to be a technology that's going to be very exciting. It's thought that fat has a tremendous amount of stem cells that have great healing potential, and this may really truly revolutionize grafting as we begin to bioprint skin. And then finally, I also talked about the idea of beta blockers, topical use of beta blockers that block catecholamines, which normally inhibit wound healing. In high stress situations, maybe a chronic wound, there's evidence in burns that if you block that binding of catecholamines to the beta adrenergic receptors, you can stimulate the cells to do more of what they should do: migrate, produce blood vessels if they're healthy blood vessels, and so forth. So it's a very simple, inexpensive way to deliver kind of cutting-edge care. It's not for every wound, but for many wounds in need, it's a great way to enhance the healing. And then finally, what I didn't talk about, but I'll share with you, is some novel studies that are going on for pyoderma gangrenosum, specifically the biologic spesulimab, which is approved for generalized pustular psoriasis, is now in randomized controlled trials for pyoderma gangrenosum. Enthusiasm is high. We'll wait for the data, but it could really kind of change the course of the disease for many patients.